Good afternoon, everyone. Welcome to the 7th Featured and Scientific session of GEEF 2026. My name is Ji-Seung-woo, General Manager of WID Headquarters, and I'm honored to serve as your moderator today. This session carries a very special meaning for us since as it's been organized to commemorate the 20th anniversary of the founding of WID. WID is a nonprofit organization with specialized nutrition expertise dedicated to addressing critical issues in international health and nutrition. For the past 2 decades, we have aimed to bring holistic recovery and healthy changes to the lives of our suffering neighbors around the world. Our theme for this hour is climate crisis and nutrition security for building resilient communities. This topic sits at the heart of this year's GEEF theme, Time for Action, Emerging Technologies and Global Solidarity, because the climate crisis is no longer just an environmental issue. Rather, it is a direct threat to the food we eat and the health of the most vulnerable. So today, we aim to move beyond identifying problems to discussing practical, integrated solutions that link climate crisis with nutrition interventions. Before we dive into our discussion, let me briefly share the flow of today's session. Following this opening, Professor Sunita Kadiala will deliver a 20-minute keynote on the main theme of this session. Then we will spend about 30 minutes hearing from our 3 expert panelists who will provide field-based case study from Madagascar, public health perspectives, and an analysis of climate response programs of WID. Then, finally, we will conclude with a 5-minute interactive Q&A session with the audience, followed by closing remarks. Okay, then without further ado, it is my pleasure to introduce our keynote speaker, Sunita Kadiala, Professor of Global Nutrition at the London School of Hygiene and Tropical Medicine. As a leading expert, she will illustrate the critical linkage between the climate crisis and nutrition, offering practical strategies to build more resilient and sustainable food systems for the future. Professor Kadiala, the screen is yours.
Can you hear me?
Yes.
Yeah, can you see my screen?
Yes.
Oh, great, thank you.
Go ahead, yes.
Yeah, thank you. Thank you for inviting me to this event, a very important event. I'm delighted to be here, and as I've been kindly introduced, I'm a professor of global nutrition at the London School of Hygiene and Tropical Medicine. Without further ado, I will just get into my talk. I'll be talking about climate crisis and nutrition security, and will leave you with a few impressions on how to build, illustrations on how to build resilient communities. It's probably most of you know this by now. Undernutrition and nutrition-related chronic diseases remain pressing concerns. For example, 22% of all children are stunted, while wasting still remains quite high. Anemia among women of reproductive age is alarmingly high and persistently and stubbornly so. All this while when the rates of nutrition-related non-communicable diseases are escalating much faster. We don't know that child undernutrition has grave consequences with, for example, approximately 45% of child deaths attributable to child undernutrition. Research shows that 2 to 5 billion people are at risk of inadequate intake of various key micronutrients globally, as this graph goes, including iron, folate, vitamin E, iodine, and so on. The estimates of global burden of disease again also show that malnutrition, dietary risks, and nutrition-related chronic diseases, for example, high blood pressure here, high body mass index, and high plasma glucose level, are 4 of the top 5 important causes of global mortality and morbidity. So populations need to be consuming healthy diets, but these healthy diets in low and middle income countries continue to be unaffordable, with the exception of India. This is from FAO State of Food and Nutrition Insecurity document with the latest estimates in 2025. As you can see in red are the low-income countries, and from 2017 to 2024, in about 7 years, we have seen an increase in the number of people unable to afford healthy diets. The same goes for low and middle income countries as well. And this is something that is going to be even worse in the context of climate change, as temperatures rise faster than we are hoping they would. So how are climate change, food systems, and nutrition interlinked? And let's look at some of these links first. Right? We are living in an Anthropocene era. What that means is that we are living in a geological and ecological era characterized by significant human impact on Earth systems. These graphs highlight Earth system trends in the last 300 years. Since the Industrial Revolution, which is the dotted lines, vertical dotted lines here, humans have exponentially increased their impact on this Earth. If you look at the top 3 graphs on the left, which are in blue, they show that greenhouse gas emissions like carbon dioxide, nitrous oxide, and methane emissions have been rising. As you can see from other graphs, there are also many changes to other Earth systems. For example, temperatures rising, ocean acidification, change in land use, and so on. Why is this happening? This is through human activity, as it's now very well established, through our overconsumption of fossil fuels for energy, the use of water for agriculture and industry, the destruction of the land for agriculture and livestock. So there are many pathways through which food systems, sadly, is accelerating the problem of climate change. We are also looking at planetary boundaries. Planetary boundaries are the safe limits for human pressure on 9 critical processes, which together maintain a stable and resilient Earth. This construct was first proposed by Stockholm Resilience Institute, I think, in 2009. And as you can see here, the 9 boundaries are in these diagrams here. And 7 boundaries were assessed in 2009, and we had already crossed 3 of these boundaries. And by 2025, in a span of for about 25 years, of all the 9 boundaries assessed, we have already breached 7 planetary boundaries. This is increasingly worrisome, and maintaining stable and resilient Earth is increasingly challenging. So how do food systems contribute to greenhouse gas emissions? They contribute about 21 to 37% on average, based on the different modeling studies, to greenhouse gas emissions. And as you can see here on the left-hand side, the food component is broken down to various parts, and livestock and fisheries contribute the most, followed by crop production, and land use change, and supply chain, which also includes transportation, retail, packaging, and so on. But greenhouse gas emissions are not the only issue. There are other environmental impacts the food system imposes on this earth. For example, 70% of our global freshwater withdrawals are for agriculture, and food systems is implicated as one of the predominant factors in loss of habitat and biodiversity. And we are also shining light on other aspects of the challenges of the food system on this environment and therefore climate change as well. And this year alone, 390 metric tons of plastics waste will be generated globally, and only 11% will be ever recycled, lest you think that you're all putting in your recycling bins. How do we know? It's very difficult to disaggregate where all these plastics are coming from. But as an illustrative point here, if you look at the International Coastal Cleanup data from 2020, of the top 10 items found in these coastal cleanup, 8 are from the food industry, like food wrappers, plastic bottles, plastic bottle cups, so on and so forth, including plastic grocery bags, takeout containers, and so on. And what we found, taken together, if you look at the burden of plastics on human health, this is a paper just got published from our in Lancet Planetary Health in this year, is that more than 80 million years of healthy lives are lost globally as a result of plastic life cycle emissions under a business as usual scenario. Remember that plastics are nothing but carbon, and they are an output of the fossil fuels, which is where the climate change is the leading pathway from plastics to human health, followed by air pollution, and followed by human toxicity. Obviously, there are huge gaps in this data, and we consider this also underestimate. Now, of course, food systems are affecting climate, but the climate change also affects food and nutrition security. This is obviously, there's a lot of information here, but I'll try to give you this as a nugget. This figure shows how climate change and climate variability, like rising temperatures, extreme weather, altered rainfall, disrupt food systems, water quality, essential infrastructure. These system-level disruptions then undermine food security, diets, and health by reducing food availability, affordability, safety, access to clean water. Ultimately, these pressures contribute to nutrition-associated conditions such as hunger, stunting, wasting, micronutrient deficiencies, and non-communicable diseases. I will illustrate these impacts through different mechanisms. The first is the biological mechanism. If you take a look at heat stress, this is again work done at LSHTM at the MRC Medical Research Unit in the Gambia. What we find is that heat stress during pregnancy causes fetal strain and therefore adverse birth impacts. Through altered maternal physiological response and maternal heat strain. And we do know that adverse birth outcomes are quite detrimental for a child to thrive, leave alone have an optimal nutritional outcome. Climate change also reduces the crop yields, and this is a graph that is showing that while some areas become warmer and may improve the crop yields, most parts of South Asia, Sub-Saharan Africa, even including United States and Southern America, will see up to 50% declines in crop yields. But not just yields, we also need to look at the quality of food we are eating. And here is a modeling study taking various factors into consideration. And we find that by 2050, I think this is by 2050, combined impacts of positive influences, our current dietary patterns, as well as negative influences, we'll be looking at a decline in protein by almost 20% and about 15% of decline in micronutrient deficiencies, micronutrient supplies such as iron as well as zinc. And And here is a famous quote in the water world, which is that if climate change is the shark, then water is the treat. So here is another pathway through which climate, food systems, and nutrition, food insecurity can intersect. We developed a conceptual framework looking at pathways through which flooding might affect food insecurity. And the boxes in green basically show the ways flooding might directly affect food insecurity alone. Through limiting, for example, food availability, increasing food prices, and so on. The boxes in blue here show how floods may affect water insecurity through destruction of water infrastructure and contamination of water due to pathogen runoff. Our mediation analyses show that water scores mediate about 31% of the association between flooding and probability of being food insecure. So this is huge. The impact of water, climate, extreme weather events such as flooding, water insecurity, and food insecurity, these are pretty strong, and the magnitude of this strength is also pretty important and strong. So as a last part of my talk, how do we build nutritionally resilient communities equitably while confronting climate change and protecting nature? There are two major approaches, as several of you probably already are quite familiar with these approaches, is adaptation, which is basically actions to cope with environmental impacts, such as through either technology, behavioral changes, and other nature positive solutions and so on, or mitigation, which are actions to decrease environmental impacts. It is rather, instead of coping with increased, say, greenhouse gas emissions, how do we reduce them in the first place? For example, reducing waste in the system, using plastics only for very non-essentials, which itself is a controversial issue, and eliminating all the plastics, or changing production methods through technology to be more green, but also changing the demand for the most damaging goods, for example, very high meat consumption and so on. So there are many of such frameworks in various shapes and forms and colors that have been proposed, and I chose this one from the Eat-Lancet Commission, which is one of the latest ones here. And what this diagram shows is how transformation of our food system depends on three fundamental rights, right? Realizing these rights, which is right to food, right to a healthy environment, and right to decent work. From these rights flow three big goals: that ensuring everyone can eat a healthy, sustainable diet, producing food with planetary limits, and securing fair, safe, and livelihoods for the workers working in the food system. The outermost ring here turns these goals into practical actions, from shifting diets to healthy diets, restoring ecosystems to reduce waste, and guaranteeing fair wages, showing that real change can be possible, and it requires a whole systems approach as well. These conceptual tools are important to enable us to think, but in the end, we do need to operationalize such actions on the ground. And again, I'll leave you with three specific examples as the last part of my talk here. Again, with research undertaken from the London School of Hygiene and Tropical Medicine with its global partners, but I'm sure several of you are involved in such endeavors here as well. The first one is really supporting national governments by colleagues Pauline Shielbeek and others at and with the MRC unit in the Gambia, with the government there. What we had done was to predict the future food scenarios, adapting this tool of global food supply production tool, including domestic demand, the trade flows, as well as domestic supply drivers. And the colleagues built 4 scenarios, modern adaptations that could benefit the environment as well as health, looking at their core benefits as well as trade-offs, and engaged with stakeholders in the country for prioritizing actions on the ground. The other 2 are examples from India where I lead this work, where we looked these are basically participatory work with communities that are affected. and people with lived experience. This is a trial that we conducted called the Upavan trial in Odisha, which included a participatory design with participatory videos and participatory learning and action cycles, designed to be feasible for local context, constraints, including climate shocks. And nutrition objectives were embedded right from the beginning as we conceptualized to implemented the intervention. And women were at the center of this intervention. They were delivered through self-help group platforms in India. And what we find is that when thoughtfully intervened and co-designed with communities, interventions can be cost-effective in terms of improving maternal and child diets. The last example is about our current ongoing work through a program called Infusion, which is a large partnership with several Indian partners in 2 states, in Bihar and Odisha. Now, in many parts of the world, including India, over 80% of nutritious foods, such as fruits, vegetables, animal source foods, are actually bought in the local food markets. And they look like this. They are characterized by poor infrastructure, poor transportation facilities, lack of cold storage, and almost absent market price information systems. And obviously, climate change, I already discussed all these linkages, but climate change exacerbates all these things at the local market level, including accelerating food loss, price volatility, as well as therefore affecting affordability of these foods and also food safety. What we're doing in Bihar and Orissa is looking at these interlinkages really at the local levels, covering all the, most of the markets there, and modeling scenarios to come up with interventions on the ground in the context of the climate challenge on improving the range of foods, the hygiene, reducing food losses, making it gender transformative, but also remember to increase the demand for actually nutritious and healthy foods. Now, and we are doing, it has taken 2 different forms in Bihar. They're called Didi Hearts. Didi is an elder sister. And this is the healthy heart concept with those petals operationalized into these interventions, both these interventions in Bihar. And we are working with government of Odisha here. And we have just launched a trial called Sehat, which is basically, again, a healthy heart concept of a 2-armed cluster randomized controlled trial with participatory design to rethink how we look at local food markets and how they can actually improve our nutrition outcomes of the most vulnerable. Now, that is a lot. As you can see, this requires quite a lot of interdisciplinary work, research collaborations, building capabilities and mutually sharing them with each other, and large collaborations between researchers, practitioners, and policymakers. We established a global platform called the Agriculture, Nutrition, and Health Academy in 2015, and now it's in its 3rd phase. And now we are calling it the Science Policy Platform. And it's a global evidence platform accelerating actions towards equitable and just food systems for nutrition and health. We are a 13,000 member network with the various work streams. Some of you may have known or heard of the IMANA program, this is an expansion of that. With 13,000 members, again, researchers from several disciplines, practitioners and policymakers. They are from 160 countries, and 65% of our membership is from Asia and Africa. So yes, engage in this community and other communities such as that, so that we can accelerate generation of evidence of what works, share our capabilities and build collaborations to inform our actions. Thank you very much.
Thank you so much, Professor Kadiola. It might be very early morning in London, I guess. Your profound insights on the climate nutrition nexus was really helpful for us, because you mentioned the current status, climate crisis related current status, and structural linkages between climate crisis, food system, and nutrition, in addition to practical actions from policy to community-based interventions on the ground. So it was perfect and really insightful keynote message for us. And to deepen this discussion with field-level realities and public health perspectives, I would like to introduce our three distinguished panelists. First, Clémence Pinault from the Belle Avenue NGO in Madagascar, joining us online to share a case study from Dulia region. And second, Moon-Kyu Kim, professor of the Department of Pediatrics at Yonsei University College of Medicine, who is here with us on site. And Yeon Kyung-seo, director of the WITH Institute of Nutrition Improvement, also here on site. We will hear from each panelist about 8 minutes. And Clémence, are you there? Hello? Okay, yeah, we can see your screen now. Okay, it's
All right,
over
so
to you. Yeah.
Thank you for receiving me. So I want to share with you a little bit some of the insight about the region of South Madagascar, especially in Toliara, which is where our NGO is based. And it's also one of the regions which is hit the hardest by the climate shock and the food insecurity. So please first let me introduce you a little bit about our NGO. So our NGO is named Belle Avenue, which means a good future. And we're working in the south of Madagascar, which is the poorest region of this country, since 2003. And we work with children, vulnerable children and communities, and especially around education, nutrition support, environment awareness, and child protection. And we've had over 30,000 beneficiaries over the years, and we're based in 5 different cities and towns in the south of Madagascar. So first, I want to share with you some of the root causes of the food insecurity in this area. So one very important one is the climate shock. We have what we call locally the kere, which are the droughts, the recurrent droughts that really disrupt the agricultural cycle, especially because most of the population that cultivate the crops here, they only rely on the rain. So we have irregular rainfall, and we also have cyclones, very destructive cyclones, almost every year, which destroy the crops and the infrastructure. We also, one of the main causes is the environmental degradation, which, so for instance, we have a severe deforestation problem in Madagascar. As an example, between 2001 and 2023, Madagascar lost nearly 5 million hectares of its forest, which represent about 29% of the forest of Madagascar. And Madagascar also face a very big problem of soil erosion, the declining fertility of the soil, and this also could be induced by the deforestation. And all of this participate to reduce agricultural productivity. And then the third part that is maybe a little less visible is structural poverty. So in the south, around 70% to 90% of the population lives below the line of poverty. And most of the people there are agricultors. Over 90% of the population cultivate, and they often have a very small plot of land, which is less than a hectare. And because of the poverty, they have almost no access to like any kind of like market, education, basic needs, and or machinery, modern inputs to improve their yield of their crops. And one also big problem that participates to the poverty is corruption, which is a big problem in Madagascar. It was ranked in 2025 by the Corruption Perception Index, 148th out of 192 countries. So all of this participate to trap their household in a cycle of poverty and food insecurity. So some data about the food insecurity in Madagascar. So 70% of the population is facing acute food insecurity, meaning that they're facing critical challenges to access any kind of food. And this number could go up to 90% by April 2026. Madagascar was also ranked by the Global Hunger Index in 2024, 124th out of 127 countries, which really highlight the alarming levels of hunger that the people are facing. There are also approximately 38.6% of the children under 5 that suffer from chronic malnutrition or stunting. And this is a nationwide data, but those numbers are even higher in the south, which has a lot of droughts and poverty. And there's around 7.7 children under 5 that are wasted, which means that they're too thin for their heights. And there's one assessment by Save the Children that said that the acute malnutrition amongst children under 5 could rise up to 74% by April 2026. So I'm going to share you a little bit what are our action here in our NGO in the south of Madagascar to kind of fight this malnutrition problem. So we have school canteens that are free for the children. So we have 3 schools in our NGO, and we serve over 2,300 meals every day from Monday to Friday to the children. And then we have nutrition centers, which are canteens for the children going to public school. And we have 2 of them serving over 100 meals per day each from Monday to Saturday. And we try to serve a very healthy and balanced diet, because most of the children, for most of them, it's the only food they will receive in their day. We also have a team of health in our NGO, and we try to monitor and detect some the cases of malnutrition. So every beneficiaries, regardless of the program they're in our project, some of them are not part of school, but they're playing music in some of the arts centers. But we try to detect at least 2 times a year to go see all the beneficiaries and detect the cases of malnutrition. So for the severe cases, we have developed what we call the Formula GASI, which was created by nutritionists to treat the severe malnutrition using locally available products and culturally acceptable ingredients. So this way, it reduces the reliance on important ready-to-use therapeutic foods, and it also promotes sustainability. And for the mild cases, we use moringa powder. So the moringa is a shrub that you can find in South Madagascar, and we cultivate them in one of our projects in a village nearby. And we use leaf to make this specific powder, which is really, really rich in iron, vitamin A, C, protein, potassium, and it gives a lot of micronutrients that are very good to treat malnutrition, and it gives strength to the immunity of the children and support their growth. And then finally, I want to share with you some of the action we have to try to protect the environment. So first, partnership development. So we collaborate with technicians and community organizations to promote sustainable solutions. For instance, we work with AFEDA. AFEDA means is an association of the women for the development of the neighborhood of Ancalica, which is a neighborhood in Chile where we are based. And we work with them, we buy them some reusable sanitary pads that we later on, we distribute them to our beneficiaries. We also work with ADS, which is also an NGO based in Madagascar, and they have tried to answer to the problem of deforestation because over 90% of the population used wood fire or charcoal to cook. So they created some energy efficient kitchen that reduced the consumption of the wood for the fire and the charcoal. And all of our projects are equipped with our system. And this way we can save up to 80% of the firewood that we would normally use.
Could you finish in 1 minute?
All right.
Yeah.
So we have environmental friendly practice that we promote in some of our schools, like in Fianarantsoa, and we promote organic farming without using pesticides. Community education, we have a summer camp for the children. We host over 60 children every week for 4 days, and we have workshop around environmental awareness. We also have a project named Ocean, and we go in small villages around Chile and show video about environmental protection to the villages to promote awareness. And we also have biodiversity protection project, and we have SOSAS project about protection of the biodiversity, and we have 12 hectares of mangrove of reforestation area, for instance, and we have some protected forest area and also protected animals projects. And thank you very much for listening to me, and yeah, I hope.
Okay, I'm Mungu Kim. I'm a pediatrician, and we had a review about some global level of climate change, but briefly I want to go into an individual level. My talk will be about gut microbes and climate change and the immunity and the first 1,000 days and the mitigation strategy. Usually gut microbes in low middle income country are more healthy than the high income countries, but if we have a climate change effect, there's a change in the food, change in the body, and change in the environmental microorganism inside our gut. So, and totally, there's some change in our gut microbes, and the lower middle income countries are more affected in this situation. And most affected areas are like these in the picture on the nourishment and enteric infection and heat stress, etc. Some of you may already know about yellow window, but if I briefly review about what yellow window is, it's usually the sub-Saharan countries in the African continent, Central Asia, and some Southern Asian countries. And as you can see from the map of this slide, most of the countries are samely affected. And the picture on the left side is the normal gut, and you can see some high quality foods cause the balanced micronutrition and high diversity in the gut microbes, and you can see the gut epithelium is quite healthy, but if you have heat stress and change in our environment, you can see that the epithelial permeability is changed, so all those toxins and pathogens can pass through the mucosa, and there's an imbalance between micronutrients and enteric pathogens increases, and all of this result in inflammation, which is also shown in this next slide. The villi of the mucosa of the gut is disrupted. You can see the mucosa is decreased. All of this results in the inflammation. Inflammation is one of the key phenomenon in the climate change. You can see that there are more incidents of non-communicable diseases and ongoing malnutrition, recurrent infections, and can even cause death. And immunity is also changed. Immunity is composed of a lot of components: T cells, B cells, immunoglobulins, and innate immunity. And if the immunity is weakened, it causes more infection, and the infection causes undernutrition. This is kind of a vicious cycle, and totally it results in more higher mortality. So what is the first 1,000 days? It's from conception to 24 months of age. During this time, maternal diet is important, breastfeeding important, complementary feeding is important. And if we have a problem in this, stunting and wasting happens in lower middle-income countries. And even you can see some micronutrient deficiency with normal weight, which we call hidden hungers. And I will share some of my experience in this area. During this time, chronic and acute undernutrition happens, and it results in impaired immunity, higher infection, lower school achievement, and reduced adult earning. And if we have a climate change also, it shows that water contamination, poor food security, raised food price, and poor healthcare service. Pregnancy outcome is also affected, as previous speaker has mentioned. There are columns of many issues in this slide, but I just want to focus on the first three lines, that we have more preterm birth, and we have more low birth weight and hypertensive disorders. Some research show that climate change might have a protective effect, but majority of the research show harmful effect of climate change on pregnancy. I want to just briefly share of my research a few years ago. I just collected some healthy mother and infant, and the mother was totally breastfeeding her infant. I checked some of the laboratories shown in table 1, and they seems healthy, normal weight, but all of them had lower vitamin D level, which shown in the last line in the table 1. Vitamin D should be higher than 30, but as you can see, infants had 11 average, and the mother had 12, both of them low. So I also compared with the history of anemia on the mother. They had even though it's about the history of anemia, but they had a profound deficiency in vitamin D. So this is kind of a hidden hunger, even happening in Korea, such as a higher income country. So it will be more severe in lower middle countries, and it showed a very high correlation with mother and child, as shown in figure number 1. So mother and breastfeeding infant is closely related. So what are the benefits of breastfeeding? As I'm a pediatrician, I only knew about the medical perspective, which means that it's a human protein, it's a balanced nutrition, help the infection protection, etc. But we have to emphasize on a climate perspective. If we breastfeed our child, we have a lower greenhouse gas emission, lower water and resource use, less waste and pollution, climate resilience, and health co-benefits. So if you care for our planet, if you want to mitigate the climate change, we have to encourage breastfeeding. HAZ means height for age Z-score. So you can see that the extreme weather, even though it's dry or wet, may cause lower height. So it's a profound effect. And the most affected area is shown on this picture. And you will see that there are almost same areas with yellow window. So based on my presentation, I would like to conclude my speech saying we have to promote supplementation for mother and child, and we have to promote breastfeeding, and the social protection for pregnant women, lactating women is very important. We have to strengthen antenatal care, postnatal care, and to protect infection, we have to proactively encourage vaccination and prepare oral rehydration solution and zinc solution for diarrhea. Thank you for your attention.
Thank you so much. Next panelist, please.
Good afternoon. Today I would like to share how field-based nutrition program implemented by WEED are responding to the climate crisis and what lessons these experiences offer for building climate resilient communities. My presentation will be organized as follows. WEED focuses on what we called the yellow window. The yellow window refers to 73 countries that are highly vulnerable to hunger, poverty, and nutrition insecurity. This climate risk index map shows that extreme weather events linked to climate change are affecting countries across the world. However, 8 of the 10 countries most severely affected in 2024 are low-income or lower middle-income countries. This shows that poverty, food, nutrition, health vulnerabilities in yellow window countries are becoming even more severe under climate change. Nutritionally vulnerable populations are particularly at risk in the context of the climate crisis. WEED currently develops and implements life cycle health and nutrition programs. These programs support nutritional needs from pregnant and lactating women to infants and young children, school-aged children, adults, and the elderly. They include both nutrition-specific interventions, such as direct nutrition support, and nutrition-sensitive interventions, including WASH education and social protection. For this session, we reviewed 4 field-based nutrition programs implemented over the past 20 years. These programs include maternal and child nutrition, school feeding, and non-communicable disease prevention program in Cambodia, Tanzania, and Madagascar, Mongolia. We examined these programs from the perspective of climate response. When we look more closely at this program, we see that main field activities are already connected to climate response. In rural Cambodia, nutrition supplements are produced using locally grown crops. This reduces food transportation distance and strengthens local nutrition supply system. In Tanzania, school feeding programs use locally procured foods to ensure that students continue to receive stable meals even when climate shocks affect food production. In Mongolia, WEED has trained local nutrition professionals who operate programs including school feeding, hospital nutrition services, nutrition education, and online nutrition management systems. These efforts promote healthy diets and low-carbon food practices, contributing to climate-responsive health systems. 3 key lessons emerged from these field experiences. The first lesson is the importance of reinforcing community-based system. This approach leverages existing community systems while strengthening climate nutrition awareness, transforming them into platforms to triple duty actions addressing climate risk, undernutrition, and obesity. Community-based nutrition and hygiene education can strengthen local resilience, and community networks can respond more rapidly to climate shocks. For example, in Cambodia, village nutrition promoters delivered nutrition supplements to pregnant women and young children during flood season, ensuring that nutrition support continued even during climate-related disruptions. The second lesson is the importance of leveraging local food resources. Locally available foods are used for nutrition interventions, which can lead to increased agrobiodiversity and help secure local food availability. This approach helps stabilize nutrition supply and strengthen climate-resilient local food systems. For example, nutrition supplements in Cambodia are produced using local crops, and school feeding program in Tanzania use locally procured foods to provide fortified bread and meals. The third lesson is the importance of developing a professional workforce with climate nutrition capacity. Professionals who understand both climate and nutrition can play a key role in leading change in communities, schools, and health systems. With experience in Mongolia shows that training nutrition professionals can ensure sustainability and program expansion. The final slide presents the climate-responsible nutrition framework that WID aims to focus on in the future. As climate change intensifies, vulnerabilities in food, health, and nutrition are increasing. Integrating nutrition into climate response will therefore be essential for protecting vulnerable populations. Building climate resilient nutrition systems requires not only nutrition-specific and nutrition-sensitive interventions, but also the coordinated functioning of community system, local food resources, and a professional climate nutrition workforce. Strengthening climate-responsive nutrition system will be key to building communities with sustainable nutrition security and climate resilience. Thank you very much for your attention.
Thank you to all our panelists for the comprehensive and insightful discussions. We now have about 5 minutes for a brief Q&A session with the audience. If you have any questions, please raise your hand, and the staff member will bring you a microphone. When you ask your question, please state your name and affiliation first. You have a question? Okay.
Good evening. My name is Khalid Shaban. I'm here on behalf of the Jordanian government. So my question is to Professor Kim. So you mentioned earlier that climate change has altered our microbiome, gut microbiome, and the epithelial lining, in addition to the fetal health and the mother health. My question is it reversible for future human generations? Because unfortunately, climate change hasn't been reversed yet. So do you think humans can reverse these effects in the future, or will humans evolve into like a different microbiome?
Well, the research about gut microbiome is very complex and it's very hard to answer by that simple question. You know, when I started my training, we didn't have a lot cases of inflammatory bowel disease, but in Korea, it's very prevalent. So something is changing. We don't know whether it's solely caused by climate change or by other factors like changes in the urbanization of the food we take. But anyway, climate change can be connected with the gut microbes, and it's going to affect on our body itself. So we have to monitor. We have actually a lot of research papers mentioning about this project. So we didn't have enough time, so I could not show you. But if we wait a little bit more, I'm sure that we can understand more about what is happening inside our body. But if we use more antibiotics, I think that is one of the profound effect changing our microbes in our gut. So which one will be more big impact, the climate or other things? It's not concluded, but I'm very optimistic. I mean, so usually the people who live in the countries like lower or middle income country have a more healthy spectrum of microbes in our gut compared to high income. So that is why I'm a little bit optimistic about the future.
Yeah, thank you so much.
Okay, another question. Okay, yes, please.
Hello, my name is Minza Shin from WIT. Actually, I have a question for Professor Kadiola. You mentioned participatory in agriculture interventions, and I understand that strengthening local food market could help improve food and nutrition security. My question is, many of the countries we work in still face a high prevalence of stunting, and progress has been challenging. When considering both stunting and climate change, what additional factors should NGOs take into account when designing nutrition program?
Professor Cardiola, are you there?
Yeah, I'm here. Can you hear me?
Oh yeah, yes, please.
Right, yeah. I mean, that's a really good question. Most low and middle income countries are including, if they have, climate adaptation strategies, right, into their agriculture and food system interventions in general. I think the issue of stunting and our inability to change that rapidly is also a bit unsurprising, considering that when you look at where stunting rates have declined, they have, for example, in Brazil, they have taken 3 decades. And often in these studies that we do, they're about of complex interventions. The theory of change is long, and we do studies of around 3 years of implementation and so on. So I think my hypothesis is that that's one of the reasons that we are not seeing changes in stunting or the impact of these interventions on this stunting, because perhaps we are starting them rather too late. For example, if climate change is causing heat stress, fetal strain, starting an intervention in the third trimester, which is when we probably reach most of the pregnant women, is already quite late. So we need interventions that reach women and children much earlier, probably before preconception, as well, to be in optimal nutrition status, to be climate resilient and sustainable as well.
Okay, thank you so much for your answer. But unfortunately, due to our schedule, we must wrap up the Q&A session here. I apologize to those whose questions we couldn't get to. Our speakers may be available for a few moments afterwards for any individual follow-up questions. As we draw this session to a close, slide please. I want to express my deepest gratitude to our keynote speaker, our panelists, and all of you. Today's discussion have clearly demonstrated that nutrition security and the climate crisis are inextricably linked. It is evident that protecting nutrition security is a vital pillar of global solidarity and a necessary step in building resilient communities. As WIT celebrates its 20th anniversary, we reaffirm our commitment to our core values of stewardship and professionalism for the climate nutrition nexus. Building on this dialogue, we propose 3 strategic actions. First, we must strengthen our field implementation by focusing on the climate nutrition nexus. We are realigning nutrition-specific interventions of WIT to directly address climate change contexts. By linking food systems, healthy environments, and care systems, we aim to develop integrated models that prioritize climate-vulnerable regions and build lasting community resilience. Second, it is time to mainstream nutrition within global policy and public health domains. We will generate evidence-based knowledge to ensure that nutrition is no longer a side issue, but a core component of climate response strategies. By expanding dialogue platforms with academia and international organizations, WIT will serve as a vital bridge connecting field-based reality with high-level policy discourse. Third, we must scale up our impact through global solidarity and knowledge sharing using forms like GEEF or ANH Academy, which is proposed by Professor Kadiala. We will strengthen establishing sustained platforms for sharing research and practice. We can promote collective action and ensure a sustainable, inclusive future for the most vulnerable communities. And this is our call to action. We invite you to stand with us in this essential mission to bridge the climate nutrition gap and protect those most affected by our changing environment. As we honor 2 decades of WIT's dedication, your presence today strengthens our resolve for the journey ahead. And thank you for being a part of this milestone and for your commitment to a healthier, more secure world. This brings our session to a close. Thank you so much for your participation.